Yeah, I guess we should take a moment to actually talk about the two main different types of shoulder replacements,
Yeah.
which is a shoulder replacement that is the ball is the ball and the socket is replaced with another
Yeah.
socket, and then those are reversed for the reverse.
Right.
Tell me about that.
So I generally look at one, it's called an anatomic total shoulder arthroplasty, and the other one is a reverse. So an anatomic total shoulder arthroplasty is just what, you were saying, Jeff, is that, you cut off the ball, and the ball is what had cartilage on it. We're cutting it off. We're putting a new, nice, shiny metal ball on. Generally speaking, it's made of metal. There are some implants out where we have some altered bearing surfaces. And then on the socket side, you're replacing that with some form of a plastic, whether it's plastic and metal, but you have to have metal on plastic, just like what we call polyethylene, which is what's in knee replacements, hip replacements. So you have to have that metal surface on that plastic surface. And so that's, again, a metal ball, plastic surface on the socket. And sometimes that plastic surface on the back has a metal configuration that might incorporate into bone. Some are all made of plastic, so there's different versions of that, but generally it relies purely on the rotator cuff to function. So if you don't have a good rotator cuff and you have a torn rotator cuff, you would not do an anatomic replacement because you're still going to have your rotator cuff symptoms. You might have no arthritis symptoms, but you're going to have rotator cuff symptoms. So in those cases, there are people who have reverse replacement. It's done to create a fixed point of rotation so that the humeral head, that ball that's supposed to be balanced in the socket, can balance, and then you can use your deltoid to raise your arm. So as we talked about earlier, if the golf ball here is on the tee, which is here, and you don't have the rotator cuff pulling it in, well, the deltoid is going to want to pull it up. Well, when some people hike their arm like this and try to raise their arm when it gets bad enough, and they can't raise their arm. So what the reverse does is it holds the ball, puts a ball on the socket side and it puts a cup on the humeral side, so it's a fixed point of rotation. And so now when the deltoid pulls up, it helps them raise their arm straight over their head. So it is the difference between the two is obvious for obvious reasons. I mean, one's reversed, but if you think about the shoulder joint in general, it's a golf ball on a tee, but that golf ball can translate this way, and it can rotate, versus a reverse is just rotation. So there are some limitations to motion with a reverse, specifically reaching behind your back or across your body. That is tighter and more difficult to do than you could do with an anatomic replacement that's well rehabilitated.
Yeah, so I guess for the listeners who are trying to understand the difference between the two, if you've got a good rotator cuff, you get an anatomic total shoulder replacement.
Good point. So there are scenarios. So there are scenarios though where you have a certain type of bony wear patterns where you might lean toward a reverse replacement.
Okay.
There's certain scenarios where you may have rotator cuff atrophy, not necessarily tearing, but you have atrophy of the muscle or fatty change in the muscle where you might lean toward a reverse shoulder replacement. So there are scenarios where you can have a fully intact rotator cuff but still do a reverse replacement. But generally speaking, if you have a good intact rotator cuff and you have fairly central wear on your socket, you want an anatomic replacement. If you're a shoulder purist, that's what you want, because your shoulder is going to act the most like a normal shoulder. And if you're trying to get back to, I want to swim, I want to do it, like an anatomic replacement is to me the way to go.
And then for the reverses, for those situations, but the most classic indication for a reverse shoulder replacement is arthritis with a non-functioning rotator cuff.
Correct. So what we call rotator cuff arthropathy.
We touched on earlier.
Yeah.
Perfect.